Hi everyone, welcome to today's session. We're going to see some question and answers from biochemistry. So moving on to question number 1. Which test is used for detection of carbohydrates? They've given us 4 options: Burette, sulfur, Molish and Benedict's test. So the answer to this question is Molish test. So if you see the different tests, identification of protein is done by the Burette test, whereas the sulfur test is used in order to find out cysteine and the cysteine, and the Benedict test is used for the detection of glucose. So moving on to question number 2. Transport form of iron is, they've given 4 options: transferrin, ferritin, hemosiderin and bilirubin. So the answer to this question, that is the transport form of iron, is transferrin. You can have it a mnemonic like this. See, transport, transferrin. It has its own definition to it. So if you see this other things, that is ferritin and hemosiderin, these are the storage forms of the iron. Transferrin is the transport form of iron. So moving on to question number 3. Regulatory enzymes of glycolysis are, they've given 4 options, that is the hexokinase or glucokinase, pyruvate kinase, phosphofructokinase and all of the above. So the regulatory enzymes are actually all of the above. See, the hexokinase, the pyruvate kinase, the phosphofructokinase all play a major role in glycolysis. And this hexokinase, they've given, or glucokinase, it is called as glucokinase when it is in the liver. So that's the reason they've given another one name too. Question number 4. Vitamin A causes 4 options they've given: pigeon chest, Bitot spot, osteomalacia and scurvy. So vitamin A causes, you have to see, night blindness, everybody will think about it. Here it is Bitot spot. Okay, it's also pronounced as dot. So Bitot spot. So if you take pigeon chest, it is present in vitamin D deficiency. Scurvy is present in vitamin C deficiency. Osteomalacia is present in also vitamin D deficiency. So moving on to question number 5. Normal fasting blood glucose value is, they've given 4 options: 90 to 120, 70 to 110, 60 to 100 and 70 to 130 mg per dl. The answer is 70 to 110 mg per dl. See, normally less than 100 mg per dl is considered as normal. So here you can write it as 70 to 110. In most of the textbooks it's given like that. And 100 to 125 mg per dl is considered as pre-diabetic stage. So moving on to question number 6. Oxidase peroxidase enzyme system is used to determine glucose in urine, glucose in blood, both A and B, none of the above. So the answer to this question is both A and B, glucose in urine as well as glucose in blood. See, this is the reason why they use the glucose oxidase or peroxidase reagent along with O-diazide when they are doing any clinical study or in order to check the amount of glucose. So moving on to question number 7. Major lipoprotein of blood is IDL, LDL, VLDL, protein C. In some situations, they would have given also HDL inside this. Okay, so the answer to this question is LDL. See, the maximum content of cholesterol is also present in the LDL only. If I told you about HDL, no? See, HDL has a protective role in coronary heart disease. That's also an important question which they might ask. Moving on to question number 8. Galactose is necessary for synthesis of, they've given us 4 options: sucrose, glutamate, lactose, and fructose. So, see, galactose. So it has to do something with glucose kind of tose. Okay, keep that in mind. So the answer to this question is lactose. Okay, see, the galactose is nothing but a simple sugar that is transformed in the liver before it's being used up as energy. It is a precursor of glucose actually. So moving on to question 9. The earliest marker of renal damage is a known case of, in a known case of diabetes mellitus is, they've given 4 options: glycosuria, increased serum creatinine, microalbuminuria, and increased serum urea. So the answer to this question is microalbuminuria. See, keep in mind in case of patients who are already diabetic. So in microalbuminuria, what normally happens is there will be a moderate increase in the level of urine albumin. Okay, it will be a marker. So question number 10. Which of the following factor facilitates the aggregation of platelets to exposed collagen surface? They're given 4 options: von Willebrand factor, factor 7, factor 9, and fibronectin. So answer to this question is von Willebrand factor. As we all know, it plays a very major role. Now, factor 7, it is also called as pro-converting. It plays a major role in blood clotting. And factor 9 is the Christmas factor. As we all know, the deficiency causes hemophilia B. Thank you.